As discussed in Module 1, Dr. Dean Ornish conducted groundbreaking research in the 1990s, demonstrating regression of coronary artery disease through comprehensive lifestyle changes. His program focused on a very low-fat vegetarian diet, 10% calories from fat, stress management, exercise, and social support. One of the men who participated was Tom, a 57-year-old banker with moderate blockages. At baseline, Tom's arteries were 40% blocked and he was on cholesterol medications. He led a sedentary life and enjoyed steaks, cheeseburgers, and beer regularly. As part of the program, Tom switched to a plant-based diet with tofu, lentils, fruits, and vegetables. He began walking an hour daily, practiced yoga, and learned relaxation techniques. In social support groups, Tom found camaraderie with others making lifestyle shifts. He discovered cooking could be enjoyable in new, healthful ways. Over the first 6 months, Tom lost 15 pounds and increased his treadmill time significantly. Remarkably, his follow-up angiogram at 1 year showed his blockages had decreased to only 25%, a true reversal. Additionally, his cholesterol dropped dramatically, allowing him to discontinue medications. Nearly 20 years later, at age 75, Tom remains largely disease-free thanks to sustaining most of the lifestyle changes. He now advocates for others through community health coaching. His success story provides a powerful real-world example of how comprehensive lifestyle modification through Dr. Ornish's program can reverse even moderate heart disease. As discussed in Modules 1 and 6-7, the National Diabetes Prevention Program, NDPP, was launched to disseminate the successful lifestyle intervention strategies from the Diabetes Prevention Program clinical research trial. One such implementation is through the YMCA of Southern Arizona. In 2017, Amanda, a 46-year-old mother of 2, was diagnosed with prediabetes through an annual wellness exam. Her doctor referred her to the YMCA's CDC-approved NDPP Lifestyle Change Program. For 1 year, Amanda attended weekly group classes led by a trained lifestyle coach focused on nutrition, physical activity, and overcoming challenges. She learned to track her meals and steps using a fitness tracker. Together with classmates, Amanda problem-solved barriers and celebrated small wins. By making modest dietary tweaks like swapping sugar-sweetened drinks for water and squeezing in brief walks during lunch, Amanda was able to lose 15 pounds through sustainable habits. At her 1-year weigh-in, her A1C level had dropped to the normal range, significantly reducing her type 2 diabetes risk. Amanda feels empowered to now maintain these changes for her long-term health. This real participant success illustrates how evidence-based research can powerfully impact public health when effectively implemented at the community level through programs like the NDPP. As discussed in Module 2 regarding dietary patterns, many lifestyle medicine experts emphasize a whole food, plant-based diet. The Physicians Committee's annual Plant Strong Community Challenge is one program that implements this approach on a population level. In 2022, over 1,000 individuals in Fort Collins, Colorado participated in the 4-week online challenge to adopt a plant-based diet and share their progress through social media posts. Sarah, a 42-year-old mother of 3 young kids, was curious to try it for health and environmental reasons. Sarah found delicious, whole food, plant-based recipes to cook for her family via the challenge website and Facebook group. She learned cooking tips like batch preparing meals on Sundays to save time. Sarah also realized making small, gradual shifts was most sustainable, like replacing half the ground beef in spaghetti sauce with lentils. By the end of the challenge, Sarah was thrilled that not only did she feel better with more energy, her family of 5 reported enjoying the new plant-centric meals just as much or more. Sarah decided to continue focusing on whole, minimally processed plant foods going forward, and even convinced some relatives to try new recipes. This real example demonstrates how a community-wide campaign utilizing online social elements can effectively facilitate positive population-level dietary changes towards plant-based eating over the long term at an individual lifestyle level. Maria is a nurse manager at a large hospital. She noticed many of the nurses on her floor spent long periods sitting at desks and computers during shifts. To encourage more movement, Maria started a walking group that meets 3 times a week during lunch breaks. The group communicates through a closed Facebook group to post photos from walks, share encouragement, and collectively log steps with a fitness tracking app. In the first 6 months, the average steps per nurse increased by over 3,000 per day, according to the app data. Morale also improved as the nurses found social support through shared challenges in increasing physical activity throughout busy workdays. Tom is an accountant who was looking for fun ways to be more active since his job involves prolonged sitting. He saw flyers at his local park advertising an adult kickball league forming on Wednesday nights. Intrigued, Tom joined and found the games a great stress reliever from work as he met new people from various neighborhoods and jobs. The games last an hour, where he gets decent exercise running the bases. In addition, his teammates sometimes organize weekend hiking meetups. After a year participating, Tom now easily achieves 150 minutes of weekly moderate to vigorous physical activity recommended for adults through this recreational league. Jasmine wanted to improve her kids' eating habits and cooking skills. She enrolled them in a 6-week after-school program held 1 day a week, where high school culinary students teach nutrition lessons and lead kids in preparing simple recipes. Jasmine's kids have learned to make stir fries, overnight oats, and pizza from scratch. They look forward to choosing the weekly recipe and have tried new vegetables at home based on what they helped prepare. The program cultivates healthy relationships with food at a young age by engaging kids in the kitchen in a fun setting. Samuel's high-pressure career was taking a toll on his stress levels and sleep. A colleague recommended he try a digital lifestyle coaching service. Through an app, Samuel scheduled one-on-one video chats with his coach to create strategies like an evening relaxation routine and tracking how tech devices before bed impact his sleep quality. They also set weekly check-ins to problem-solve challenges. Samuel quickly saw benefits from the simple changes. He now takes a walk outside after dinner while listening to calming music instead of drinking coffee, and charges devices in another room at night. His stress levels have reduced significantly based on the app's mood surveys. Feeling more recharged through better sleep habits, Samuel is happier in his personal and work life. Christina noticed her kids were glued to screens more at home, which led to bickering. To encourage family bonding, she decided to host weekly game nights. The family collaborates on a menu of snacks and devises a fun activity: charades, Pictionary, tabletop board games, etc. This dedicated screen-free family time has strengthened their communication and relationships. The kids now look forward to their special nights together and feel less urge to argue. Christina has also decreased her own device usage as she focuses on engaging with her family. Patricia participated in her health plan's CDC-recognized diabetes prevention program held at a local community center. For a year, she attended weekly group lifestyle coaching sessions where participants learned healthier cooking, took field trips like grocery store tours, and supported each other's weight loss and physical activity goals. Through modest calorie reduction, walking her dog 30 minutes daily, and keeping a food journal, Patricia lost 17 pounds in total. This progress helped lower her A1C below the pre-diabetes range, allowing her physician to discontinue diabetes medications. Patricia has maintained the changes 2 years later with the skills and friendships gained. Public health researchers partnered with the city's transportation and parks departments to analyze how neighborhood design impacted chronic disease. They geocoded resident addresses from hospital records to understand obesity rates relative to access to sidewalks, trails, public transit, and parks within half a mile. Neighborhoods with incomplete sidewalk networks and farther distances to open spaces saw higher BMI levels even when controlling for demographics. This data informed the city's update of its master plan to invest in more walkable and bikeable infrastructure linking residential areas to recreational facilities. After a moderate heart attack, David joined his hospital's outpatient cardiac rehabilitation program. Supervised by an exercise physiologist, he gradually increased physical activity over 12 weeks with walks on a track and strength training. David committed to continuing independently afterward. He uses a fitness tracking app to stay motivated sharing steps and workouts virtually with other rehab grads. During severe weather, he streams outdoor exercise videos. 2 years later, David has maintained improved cardiorespiratory fitness and connection to his rehab team through the online platform, which helps him sustain a healthy lifestyle.